Right, well, I'm here today with Regis, Roche, and we're going to have a talk about the Adip'sculpt, which is a fat grafting device that's used in clinics. So welcome.
Yep.
Thank you so much. So
Thank you.
Tell us a bit about it. I'm quite excited because I know that Adip'sculpt's been on the market for a while, but it's kind of going through a bit of a rejig at the moment. So tell us a bit about it.
Yeah, so that's a product dedicated for the lipofilling technique, for the fat grafting technique, from the beginning to the end of the techniques. Means quite all the products on the market now are only dedicated for one part of the lipofilling technique, maybe for washing, maybe for centrifugation, or just for the liposuction, while all products are really from the beginning, from the infiltration, and then to the injection of the fat. This is one particular part, and the other thing is we have really focused on the efficiency of the technique. So by a specific protocol from the beginning to the end, then we have at least 70, 80 or even 90% of efficiency. Means that the quantity of fat that will stay after several months could be at least 70% or 80 or 90%.
So when someone does the procedure, using this technology, you can keep 70, 80 to 90% of the fat that's taken still stays in.
Yeah, exactly, exactly. And, with the common technique, the classical technique, usually these results are between 30 to 50%. It means that if you inject 100 cc of fat, then after 6 months you will obtain only a half.
Sure.
So with our product, you will have at least 70%, or sometimes 80 or even 90%, depending on the indication and the patient.
And it's the one product for the whole, like for the liposuction procedure, right through the centrifuge, through putting it.
There are all-in-one kits, single use. Each kit is single use. All-in-one means everything from the infiltration to the injection. And we have another device, a centrifuge, with specific containers in each kit that can fit easily in the centrifuge, of course, and with a pre-programmed centrifuge. So all the settings are already inside the centrifuge.
Okay.
And,
so for any procedure that you're after, if you're going to someone to have a bit of fat transfer done to your face, or if you're having fat transfer to the breast, or anywhere there's fat transfer, you go through a process where you have the liposuction first, and they store that fat. Also, they don't store it; they put it in a centrifuge. It gets sort of like cleaned up, wound up.
Clean the fat, wash the fat.
Washed and cleaned, and then that's the fat that they use to inject back into your body, whether it's face, body, or whatever. And this is basically all in the one compact kit.
Exactly, and we have a specific kit for the face, because the cannulas, of course, are really thinner than for the breast. And we have a medium kit for the breast for medium augmentation or big augmentation. So that's the total range for each indication.
Alright, so it can do the butt, the breast, the face, anywhere you want to transfer.
And it could be in the hands also. It could be everywhere in the body.
So people want fatter hands.
Yeah, when you have a thin, really thin skin or all skin and hand, then you can re-inject a small amount of fat. And then it will have, of course, a volume effect, but also a rejuvenation effect, regenerative effect. And so you can see it after 2 or 3 months. It's not immediate. The volume is, you can see it immediately, but the regenerative effect after 2-3 months. And the same for the face. That's really much more efficient than the fillers that just have the volume. It's not only a question of volume, it's also a question of regeneration.
Of course, Alright, so 70, 80, 90% of the fat is retained, which is great because I have heard where only 20%, 30% is retained. So if you're looking for someone that actually uses this device, or if you're a practitioner who's looking at getting this device, you can drop us an email at help@plasticsurgeryhub.com.au, and any questions that you have we can ask Regis. So thank you so much for taking the time today.
Thank you very much for your time
Thank you.
Thank you for the interview.
Thank you.